I'll be discussing the transmission, prevention, education, and management of skin diseases in our athletes. Skin infections are one of the most common health concerns encountered in athletics. Though outdated, this statement found that across previous studies, more than half, roughly 56%, of all infectious disease outbreaks reported in athletics involve the skin. Athletes are particularly vulnerable because of frequent skin trauma, close physical contact, shared facilities, and sometimes poor hygiene practices. As athletic trainers, we are often the first line of defense in identifying and preventing these infections. So, how are skin diseases transmitted among athletes? The requirements for transmission include a source of infection, a host to infect, and a mode of contact. So, in simple terms, athlete A has the infection, athlete B uses athlete A's razor, and athlete B will likely get the infection from athlete A. Skin diseases are most commonly transmitted through direct and indirect contact. Direct transmission occurs through skin-to-skin contact between athletes, which is a common transmission mode in contact sports such as wrestling and football. Indirect transmission occurs when athletes come into contact with contaminated surfaces or objects, and examples of this include wrestling mats, treatment tables, shared towels, equipment, water bottles, and like I previously mentioned, razors. Poor hand hygiene is also another major contributor to disease transmission. It's really important that everyone knows how to effectively wash their hands. Healthcare providers and athletes can both unintentionally spread infectious organisms from one person to another or from one surface to another through inadequate hand washing. Although droplet and airborne transmission are also possible for infectious agents, direct and indirect contact remain the primary routes of transmission for all athletic skin disease. So, how can we prevent these? Prevention starts with maintaining a clean athletic environment. Frequently touched surfaces should be cleaned and disinfected regularly using a registered and approved disinfectant, making sure that we're using proper cleaning materials. Like I previously mentioned, good hand hygiene is also essential. Athletic trainers and athletes should wash their hands with antimicrobial soap often, not just when our hands look or feel dirty, which can sometimes happen. If unable to access a sink, like if you're on a field, it's important to use alcohol-based hand sanitizer. Hands should always be cleaned before and after contact with athletes and after removing our gloves. Athletes should also practice good personal hygiene. Athletes should include showering with antimicrobial soap after every practice and competition. It's also important that they wash their uniforms and essential clothing like practice material, workout clothes every day, especially if they're sweating in it. And disinfection of other equipment is also essential, like their braces or their sleeves. They should also be avoiding shared spaces like a whirlpool or a hot tub when they have open wounds, because this can only increase the infection rate between other people. Open wounds, cuts, and abrasions should be reported immediately to an athletic trainer to be cleaned and covered appropriately. No matter how small or large, it's important that we are cleaning our wounds appropriately and maintaining good health. By implementing these preventative measures consistently, athletic programs can significantly reduce the risk of infectious disease outbreaks. So who needs to be educated and how do we educate them? Education is a shared responsibility by the entire sports medicine team and beyond. Administrators must understand the importance of supporting infection control policies by providing adequate staffing, supplies, and resources. Effective leadership and communication can also help limit the spread of infections between our athletes. This includes involving custodial staff in educational programs because they're responsible for cleaning and disinfecting the athletic facilities. Without them, it would make our jobs a lot harder to maintain athlete health. Additionally, coaches should be educated on recognizing potential skin infections and reinforcing hygiene practices among athletes. Coaches play a very critical role because they interact with athletes daily and can encourage compliance with prevention strategies. One could argue that most importantly, athletes themselves must be educated on proper hygiene. Self-monitoring, reporting suspicious lesions, and avoiding behaviors that increase transmission risk can all help our athletes make sure they are educated and up to date. As medical professionals, we can educate these groups through preseason meetings, educational handouts, locker room posters, and regular reminders throughout the season. This is where it becomes important for us to build rapport with our athletes and maintain open communication to reinforce these practices further. How do we manage these conditions? Skin infections generally fall into 3 categories: fungal, viral, and bacterial infections. Fungal infections include Tinea corotis, commonly known as ringworm, and Tinea capitis, which affects the scalp. These infections are typically treated with topical or oral antifungal medications, depending on the severity. Athletes may return to play after appropriate treatment and when lesions can be adequately covered according to return to play guidelines. Viral infections include herpes simplex and mucosum contagiosum. Herpes simplex is highly contagious and often requires antiviral medication. Athletes cannot participate if they have active lesions present. Mucosum contagiosum is usually managed through removal of lesions before return to play. Bacterial infections include impetigo, folliculitis, freenicles, carbuncles, and MRSA or MRSA, which often is reported as a spider bite. Management of these include a culture to detect and diagnose, sensitivity testing when appropriate, physician referral, and antibiotic treatment. Athletes should not return to participation until treatment requirements are met and lesions are no longer draining. Prompt recognition, isolation if needed, referral for medical evaluation, and adherence to all return to play guidelines are critical in preventing and managing outbreaks. Though we have position statements like this one and each state follows its own guidelines, skin diseases remain a significant concern in athletics because of the close contact nature of sports. As athletic trainers, our role extends beyond just treatment. We must focus on prevention, education, early recognition, and proper management to maintain the health of our athletes. Through consistent hygiene practices, environmental cleaning, athlete education, and adherence to evidence-based guidelines like an NATA position statement, we can protect both individual athletes and the entire team from the spread of infectious skin diseases.